All right, today we're going to step into the incredible, high-stakes world of pediatric neurology. This is a world where doctors are basically detectives, and every single symptom is a clue. We're going to crack the code on two fascinating medical mysteries that really push the limits of diagnosis. So let's dive right in. You know, it's got to be one of the toughest questions in all of medicine. The brain is the ultimate black box, right? Especially in a child who's still developing. So when something goes wrong, the clues can be subtle, they can be confusing, and honestly, they can be absolutely terrifying for a family. So how on earth do you find the answer? Well, that's exactly what we're here to figure out.
So here's our game plan. First, we'll set the scene and talk about what it means to be a diagnostic detective. Then, we'll open up two very different case files, the case of fraying wires and the case of the smoke puff. And finally, we'll look at all the evidence and see what these cases teach us about cracking the code.
You have to understand, in this world, a diagnosis isn't just some label you read in a textbook. It is a lifeline for a family that is completely lost in uncertainty. Getting it right, well, it changes everything. It gives them answers, it gives them a path forward, and sometimes it can even lead to a treatment. The pressure is just immense, and the whole process is a true masterclass in deduction. Okay, let's open up our first case file. Just picture this. A family, obviously worried sick, bringing their child to a specialist. They've just got this collection of confusing symptoms, and they are desperate for an explanation. The investigation starts right now. Here are the initial facts of the case. We have a 4-year-old girl, and she's really struggling. She's having a hard time walking, she's falling a lot, and her coordination just seems to be getting worse. Her parents have even noticed she's regressing behaviorally. And on top of all that, doctors find stiffness in her muscles. Now, these aren't just random incidents. They're a pattern, a clear set of clues pointing to something serious happening in her nervous system. So the detectives turn to technology, and an MRI scan gives them their first huge break. The image shows damage to the brain's white matter. Now, think of the white matter as all the electrical wiring that lets different parts of the brain talk to each other. In this little girl, that wiring is literally fraying. It's losing its protective coating. This process has a name. It's called demyelination, and it is a massive, massive clue. Okay, so the brain's wiring is fraying. But why? What's causing it? To find out, our detectives have to look for a motive at the cellular level, and this brings us to a key player, an enzyme called aryl sulfatase A. The best way to think of this enzyme is as the cell's dedicated cleanup crew. Its job is to break down fatty stuff called sulfatates. If that crew doesn't do its job, the cellular trash just piles up, and the results can be devastating. And here it is. This is the moment. The lab results come back, and it is our smoking gun. The patient is deficient in that exact enzyme, aryl sulfatase A. The cleanup crew isn't working. That means those fatty sulfatides are building up, and they're the reason for the fraying we saw on the MRI. We now have a motive and a mechanism of the crime, so to speak. With this solid evidence in hand, the detectives assemble a lineup of the usual suspects. These are 5 rare genetic disorders, all known to cause serious neurological problems in kids. So, based on the clues we have, the demyelination and that specific enzyme deficiency, which one is our culprit? The evidence is conclusive. The diagnosis is metachromatic leukodystrophy, or MLD for short. This is the one disease on the list specifically caused by a deficiency in aryl sulfatase A, which leads to that buildup of sulfatides and the destruction of the brain's white matter. The culprit in case number 1 has been identified. Now, this is so important. A good detective doesn't just find the bad guy, they prove why it couldn't have been anyone else. So, adrenal leukodystrophy, ruled out because it affects the adrenal glands, and our patients were fine. It wasn't Krabbe disease, which usually causes vision loss that she didn't have. Tay-Sachs was out because it doesn't cause our key clue of demyelination. And finally, Niemann-Pick disease, that usually shows up with an enlarged liver and spleen, which our patient didn't have. Every other suspect had a rock-solid alibi, and that is how a definitive diagnosis is made. Case closed. But now, we've got a new file on our desk. Every patient is a brand new mystery, and this time, the clues are completely different. This puzzle isn't about fraying wires. It's all about blood flow. Our new patient is a 9-year-old girl, and she's experiencing these really strange, temporary episodes. For about 30 to 60 minutes at a time, she gets weakness on her right side and her speech gets all slurred. And then it just disappears. But here's the critical clue. It's triggered when she cries or hyperventilates, moments that change her breathing and the actual chemistry of her blood. What is going on here? The first look inside her brain with an MRI reveals something pretty alarming: evidence of multiple tiny strokes. These are little areas where blood flow is cut off, damaging brain tissue. This tells our detectives that the problem is vascular. It's something to do with the blood vessels in the brain. But what is causing these blockages?
So, to get a better look at those blood vessels, the doctors perform something called an angiogram. And what they find is the single defining clue of this entire case. The major arteries in her brain are getting narrower and narrower. To compensate, the brain has tried to grow this delicate web of tiny, fragile new vessels around the blockage. And on the scan, this network looks just like a puff of smoke.
So, a whole new lineup of suspects is brought in, all related to blood vessel problems in the brain. We've got things called TIAs, inflammatory conditions like vasculitis, and all sorts of blockages and malformations. But given our really unique puff of smoke evidence, what do you think is the underlying disease?
The diagnosis is moyamoya disease. And get this, moyamoya is literally the Japanese word for puff of smoke. It's named for that exact telltale sign on the angiogram. It's a progressive disease where the main arteries to the brain get blocked, leading to the exact kind of strokes our patient was having. So let's just quickly close this case file by checking the alibis. Those transient ischemic attacks, or TIAs, turns out those were the symptoms, not the disease itself. Vasculitis was unlikely because there were no other signs of inflammation in her body, and the last two conditions were ruled out because they usually cause strokes from bleeding in the brain. Our patient's strokes were from blockages. Once again, the evidence pointed to only one culprit. Okay, so we've solved two totally different medical mysteries. Pretty incredible, right? But beyond these specific diagnoses, what can we learn from the detective work itself? What's the fundamental method for cracking these unbelievably complex codes? It really boils down to this 5-step method, this detective's playbook. It always starts with listening, gathering those first clues from the patient's story. Then, you use technology to look for evidence inside the body. After that, you analyze that evidence, you form your lineup of suspects, and you systematically eliminate them until only one culprit remains. This is the heart and soul of diagnostic medicine. And this, right here, is why it all matters so much. For the families in these stories, their world is just filled with fear and confusion. This methodical, detective-like process is what cuts through all that noise. It replaces that terrifying uncertainty with a clear, confirmed answer. And once you have an answer, you can finally start to make a plan. These cases just show how far we've come. The combination of really careful observation and incredibly powerful technology allows us to solve puzzles that were once completely impossible. And it really leaves you wondering, with all the new tools and an even deeper understanding of the human code, what medical mysteries are we on the verge of solving next?